Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Yes, of course, I'm living it up. How about you?
I'm great and living it up.
All right.
All
You've
right.
learned. You've learned, grasshopper.
That only took 13 years.
In a couple of minutes.
Okay, well, we have an exciting book that you wrote for the listener who calls in today at 866-870-5752. That's 866-870-5752. Dr. Darrow's latest book is waiting for you. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies, and the foreword is written by Suzanne Summers. What do you think?
I think Suzanne Summers is amazing. I love her. Thank you, Suzanne, for everything you do in helping all of us in the medical world move ahead.
And I thank you too, even though I haven't met you yet, but maybe one of these days. So
Yeah, we'll get you together.
yeah, so we do want your calls, because this is how everybody learns about regenerative medicine, by you talking about your orthopedic pain, right?
Yeah. What we do is very simple. We take cells from your body, either platelets from the blood, or we can take your bone marrow that has platelets and stem cells. That's a buzzword today. And we can inject them wherever your injury is or arthritis. So it literally works from the back of the head when people have headaches, into the neck and the shoulders. And a lot of people have pain who have neck pain. They have pain around the scapula in the back. And that's all the way down the spine. We have people that have problems in the low back and the hips, and obviously shoulders, elbows, wrist, fingers. What else did I miss? The whole bottom of the body. The toes, the feet, the ankles, the knees. Plantar fasciitis is one of the things we treat. People that are runners have a lot of issues, obviously, in the lower extremities. Knee pain is probably one of the biggest things we get. They always say the knees go first, and we get a lot of people that unfortunately have a lot of knee pain or arthritis that we can help. And so many people have what they call hip problems. And when their doctor does an X-ray or MRI, they find a little bit of arthritis. And then unfortunately, they send them to get a hip replacement when it never really was needed. So be very careful before you end up in a surgery that you check out regenerative medicine using your platelets and or stem cells. Because most things we can help. I can't help everything, and not everybody heals. This is not a panacea or a magic wand. It just makes sense. All we're doing is growing back some of the tissue that's been injured or worn down. So I've been doing this for, since 1998, I think it is, or 97, during my residency at UCLA. And it's been a godsend for my body. I've done it on both my knees, my shoulders, my elbows, my right wrist, broken ribs, my knees, and I've had a great time in sports all these years. How about you, Nita?
Well, yes, you treated my neck and shoulder problem, 16 years ago, and then 4 or 5 years later I had a injury with my trainer, and the same injury, and you treated it again, and both times I healed pretty quickly. And
yeah, I remember you were pretty amazing.
That was quite something, so I'd never experienced anything like that before.
And same with me. The first time that I had the experience of healing using, back in the day it was called prolotherapy, proliferative therapy, from the Greek word to proliferate or stimulate and in this case to stimulate new tissue growth. I was at a seminar in Vegas on regenerative medicine. It wasn't called that then. It was called prolotherapy. And the injectable, the solution that was used in the syringe was, believe it or not, concentrated sugar water, dextrose. And there were seminars on all different parts of the body, and I went to the workshop on wrist pain because I had wrist pain from hurting myself playing golf. And it's a funny story. I like to tell it on every show. I had watched a video on how to hit a 3-wood over a tree in front of you, because 3-woods are they don't go up high in the air usually. So it was a long way to the hole, and I wanted to use the 3-wood because it goes farther. So the idea was to hit down on the ball and then get it up in the air. So I did hit down on the ball, but I missed the ball and I hit the ground. And my wrist, it hurt like you know what. And my wrist was very badly injured. I could barely pick up a pencil, and I did not know what to do. My friends who were orthopedic surgeons said, let's try a steroid shot, cortisone, which I refused because I knew that it actually destroyed the soft tissue, the tendons and ligaments and all that. And it also destroys cartilage in the joints. So I stayed away from that. And I just kind of suffered with it. I remember now I was wearing one of those black braces that you put your thumb through, goes almost up to the elbow. I'd wear that all day and sleep with it at night. And it would help a little bit, but it never got better. So I was at this seminar on prolotherapy in Vegas. I went to the wrist workshop, and I mentioned how much my wrist hurt. And the doctor who was giving the seminar said, well, let me inject it for you. At which point I was terrified about getting a shot in my wrist. And, us doctors, we like to do stuff to other people, but we don't want it to get done to us. So anyway, I decided to do it. And the doctor said, your wrist is going to be stiff for about 24 hours, then it's going to feel better, which is exactly what happened. I got very stiff, just like at the time of the injury. And I was a little nervous because I didn't really know what this stuff was. And then about 24 hours later, the stiffness broke, and my wrist was a good 50% better. And I went home, and I was very happy. And then I took out my own syringe and injected it myself. I think I had to do that a couple more times, and my wrist was completely healed. And as you folks who listen to me on the show all the time know, I'm going to go out and play golf later.
Yay.
And, my wrist is great. I can lift weights, do whatever I want. And my wrist has never bothered me since. So I'm very fortunate to discover this. And at the time, it wasn't very well known. It wasn't called regenerative medicine. It wasn't being taught. But in the last 20-some years, I have taught this to all the residents at UCLA in the physical medicine rehabilitation department. And I've got a lot of students who are out doing this all around the country now. I train doctors from all over the world doing it. And it's been a godsend for me and for most of my patients. Like I said, it doesn't work on everybody for several reasons. Actually, I'm going to ask for some phone calls because that's more interesting than me.
We have Carl.
Oh, we got Carl. Okay, thanks. I didn't realize that. I didn't look at my call screener list here. So let's do Carl, and then I'll get back to this. So, Carl, you have pain at the base of your neck, and how long has that been going on for?
Well, it's been quite some time, a couple of years now. I came to you. I had 3 appointments with you. I didn't notice one thing whatsoever from it. Maybe it would help later, I don't know, but the cost of $800 a crack is kind of expensive. Then I went to a TMJ doctor. I've been wearing the mouthpiece for a year. Nothing has helped at all.
Oh,
I've
sorry.
tried muscle relaxers. Nothing has helped. I've called the masseurs. Nothing has helped.
Sure.
I've tried acupuncture. Nothing has helped. What can I do to get this thing to go away? Because it is getting worse, little by little by little.
Okay. So, Carl, have you listened to my show before?
All the time.
Okay, good. So you know I can't tell you a thing on the radio based on what you're telling me.
Well, I'm sure you can't. You need
I have to. No, I don't need to look at any pictures. I need to touch the area. I do look at the images just to make sure you don't have cancer or something weird like that. But we don't well, when I say we, that's wrong. I don't diagnose anything based on images, X-rays or MRIs or CTs, unless it shows a fracture or something like that, or it shows some kind of a growth. The diagnosis comes from moving your body around and touching the area, what we call palpate. And if you're tender, then we know that's a pain generator. So there's a lot of things that go into figuring out where to actually inject the area. And some areas I'll use an ultrasound to look inside the body to help me figure that out also. But I would say, why don't you come back? Let me take a look. I won't charge you for a visit. And let's talk. Let me examine the area, touch it, and see what's going on. Things may be different than what they were when I saw you a couple of years ago, too.
Well, the only thing I can say from a layman's standpoint is the spasm is so bad that I almost can do nothing.
Right.
It's just that it's so tight. It's like a bowstring back there. It's so tight. And absolutely nothing has worked by anybody.
Sure.
And I'm not giving up hope. Something, somehow, some way will work.
Yeah, good.
So
I agree with you. You never give up hope. So let me just tell you and the listeners reasons why regenerative medicine fails, okay? Mm-hmm. The number one reason is people don't do enough of it. They think 1 or 2 or 3 treatments will do it. And from my experience on my own body, I've had things heal overnight, literally. Like my wrist was 50% better the next day. And then I injected a couple more times and it was perfect. But most people either don't have the patience or they don't want to stick to it or they didn't like it or it costs money or whatever the reason is. So that's the number one reason it fails. Not enough treatment, not enough time not enough treatments to grow back the tissue and stabilize the area. So that's number one. Mm-hmm. Number two, a lot of people will take anti-inflammatory medicine for headaches or whatever it is, and they don't realize that blocks the biosynthesis
I've never
of collagen.
Taken those things. No.
No, I'm not blaming you, and I'm not telling you. I'm just telling you generalities of why it doesn't work. Another huge reason is people are they still do the same activities that cause the problem. So someone will come in. I'll give you an example. I just had a guy come in with arthritis in his knee, and we injected his knee, and he came back. He said he didn't get better. I said, were you doing anything to aggravate it? He goes, no. I said, do you walk stairs? He goes, yeah, I've got 3 flights of stairs in my house, and I've been walking that every day. And I go, we talked when you came in, and I said, stairs are pretty much out. Okay? That's exercise. Obviously, if you need to go up the stairs, you need to go up the stairs. But I've had patients who actually will go drive to their gym or their neighbor's house to take a shower because their shower is upstairs. And they'll sleep on a sofa or a futon on the floor on the first level because they want to heal. So you've got to be motivated to have this stuff work. And I tell people, I said, pretend you had surgery. What are you going to do? You're going to go up and down stairs after knee surgery? No, they're going to tell you not to do it. Mm-hmm. So it's the same thing with this. It's not surgery, thank goodness. And unfortunately, I wish it were different, but the surgeries fail at least half the time in my experience. And in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, there's a lot of studies here. There's 250-some studies talking about the benefits of doing regenerative medicine injections versus surgery because the surgeries fail too much. Now, I had a surgery, since you listen to the show, you know this, but not everybody else does. I had a surgery on my shoulder. By the way, hang on 1 second. I'm going to get out the phone number so we can get more callers. If you want to speak to me right now, like Carl is doing, the phone number to the studio is 866-870-5752. I'll repeat it for you while you grab your pen. It's 866-870-5752. And for those of you who have catch the show when it's not live, the number to the office is 800-300-9300. That's 800-300-9300. You can call my staff anytime you like and maybe get a hold of me at the office. But to get a hold of me right now, I would love to talk to other people. We'll finish up with you too, Carl, so don't go away. But the number of the studio right now live is 866-870-5752. We're getting a few more callers with that. So, Carl, there's a couple other reasons. One is some of the doctors doing this, I'm going to say most of them really, have not been really trained in it very well, and they don't do that much of it. So they don't know how to do it properly. This is all I do. This is my work. I've been doing it for almost 25 years, and this is all I do. I'm not saying I'm the greatest on the planet, but I do probably more than anybody. I've been told when I go to national meetings, people come up to me and go, "How do you do so much?" They say I do in one day what they do in a month. So I do tons of it. I've seen all kinds of reactions to it. And I have a lot of experience in the field of regenerative medicine with stem cells and platelets. Another thing is a lot of doctors don't know how to use an ultrasound to look inside the body. We don't need to do that necessarily on your neck, but definitely we need to do it to guide needles, to watch where the needle's going, say, in the hip or the knee or the shoulder. Otherwise, you miss the joint totally. And for years and years at our national meetings, people would say, "Why don't hips heal very well?" And then we got ultrasound guidance to see where the needle was, where the hip joint is, and all of a sudden, hips started healing just like everything else. So there's a lot of reasons why it doesn't work. Again, I would love for you to come in the office. I'm not going to charge you. You know the phone number. It's 800-390-300 the office. You can call right now, and I'll get you in Monday morning if you want, or Monday afternoon. And I'll test it for you. It won't cost you a penny. I'll examine you, and we can talk and see what's going on with you. I think if it's stuff in the neck, that usually heals up. Okay.
Well,
and like I said,
just one thing, and then I'll get off.
Sure.
The problem is that I came there 3 times. Now maybe it just wasn't enough. I don't know. And I went to a TMJ doctor. I've been going to him for a year with the mouthpiece in my mouth, which I even have in right now, and it's not one bit better than when I started.
Yeah.
I'm kind of getting to the point of desperation. I'm saying, look,
well, Carl, I hear you. You've said that a couple of times, and I get it. It's very frustrating. Nobody likes to have pain. I think I have the toughest patients on the planet, just because they're very unhappy about their pain. It just nags at them all day. But pain at the base of the neck, we can usually get rid of. That's all I can tell you.
Okay. I guess I'll just have to call the office and come in again.
Give them a call, 800-390-300. They're there right now. And they'll take your call. If they're busy, they'll just leave your phone number. They'll call you right back. Okay. And I'd love to see you. Tell them not to charge you anything. And I'll just see you for free. You can come in Monday, and we'll get to the root of what's going on and have a nice long discussion, answer all your questions. Okay. And I'd love to see you, Carl. I'd love to help you. And I always tell people this. When you're unhappy, I'm unhappy. I need you to get better for me to be happy.
Well, I know there's an answer to this. It's just that no one's found the answer yet.
Well, let's go for it, and let's keep digging, okay?
Okay, thank you very much.
All right, God bless you, my friend. Thank you so much for calling in, Carl. Yeah.
And I'm unhappy too. So call 866-870-5752. We don't want you in pain. 866-870-5752 right here in the studio. You want to go to Susan?
I would love to. Hi, Susan. It's Dr. Marc Darrow. And you've had different types of therapy years ago. For what part of your body?
Susan, are you there? Can you hear us?
Oh, I'm so sorry. I had bad reception. I experienced years ago. I had my back. I have 4 hernia discs in my back. I had prolotherapy done, the one you were talking about with the dextrose solution. And I just wanted to call in and just share. I had an amazing experience, and that was before they were doing the stem cell injections that you're doing now.
Sure.
And I wanted to share with you. I had a friend back then who was an MRI technician, and he saw MRIs every day of people that had had surgery, and showed me the scar tissue that builds up after repeated surgeries, and that many times people have to go back and have scar tissue removed because the scar tissue ends up creating more of a problem than what they had that caused the surgery in the first place. So I had an amazing experience. I ended up having my neck, shoulders, hips, and the lower back done. And
Wonderful.
It was amazing. So if anybody's thinking about it or is on the fence, I would definitely seek out getting prolotherapy with the stem cells now than I ever would going to get surgery. Because doctors had recommended, 3 doctors.
We lost you, Susan.
So
you want to repeat that?
Yes,
you went to 3 doctors that recommended surgery, which is typically what's done. Now I have to say this. I have herniated discs in my neck, okay? Who cares? I have no pain. I have no pain down my arms from it. And too many surgeries are being done today for the wrong reasons. You don't look at an MRI to decide if you're going to do surgery on someone. You look at what the symptoms are. And I can tell you this, for the last 20-some years, I've had new patients come in saying, just like you did, I went to 1 or 2 or 3 surgeons who said I had to have surgery. Some have said I'll be paralyzed if I didn't get a surgery. And they didn't do it. And we get callers like you all the time who said, yeah, I was told I had to get surgery. I didn't do it, and I'm fine. So,
well, that's like you kind of you panic because you're told all these terrible things. But
I know.
I still have 4 herniated discs, but I don't have any back pain. And I went to Dr. Miles Onley. He was the guy that brought it to this country. And when I had it done, it was before so many people got trained to do this. Now they're, people like yourself. There's many choices now. But I have a knee that's bothering me right now that I'm going to give it some time. But I may be seeing you about my knee. But I wouldn't put it off at all. Getting prolotherapy, though, or what do you call it now, regenerative therapy?
They changed the name to regenerative medicine, but it's all prolotherapy, even if it's stem cells, meaning we're there to proliferate or stimulate new tissue to grow. So
that's a bonus.
You could call it PRP prolotherapy. You could call it dextrose prolotherapy. You could call it stem cell prolotherapy. And I've used many other stimulants like that, proliferants, I should say. To grow the tissue. Sodium moruate is another one I've used, zinc sulfate. I've tried a lot of things, and they all work to some extent. There's a doctor who used to be in Milwaukee, I don't know if he's still around, who used saline, concentrated saline. But the problem is with dextrose or saline, things like that, they can work somewhat, but they're not very strong. They're not as efficacious as the newer things being used. And I know that because I injured my knee. I haven't told the story for a long time, but Dakota, my 85-pound husky, was running full speed in the dog park. I didn't see him coming, and he hit me on the side of the knee, on my left knee. And it loosened up my whole knee. My patella was loosened up from what's called the retinaculum, which is the covering. And my knee would not bend without catching. And I did dextrose prolotherapy on myself about a dozen times or so, and it would help. But anytime I ran, it would loosen up again. And I did 1 PRP on it myself, and it just tightened right up. So my experience, and it's just me, is that dextrose is not as strong as PRP or stem cells, and I've done stem cells in my knees too. It's probably about 1/10 the efficacy as these newer modalities. It's good, but it's not as good. Okay?
Yeah, I just think it's a huge bonus. Before I got my prolotherapy, I had a terrible sciatic pain to where I was in tears because I couldn't get out of my car. It was just like something had to happen, but I would definitely do prolotherapy. So anyway, I just wanted to share my
Thank you so much. I really appreciate you calling in. Susan, you helped a lot of people today by calling in, because all the people listening.
I hope so, because people are scared, and it's something it's foreign. It's a new idea to them, but just don't overlook this, because this is it's a
God bless you, Susan. We're going to a break right now. If anybody wants to get to me, call the studio now at 866-870-5752, and go to the website. You can watch the procedures, www.lastemcells.com.
You're listening to Living Pain Free with Dr. Marc Darrow, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.